The passive straight leg raise test and the cross straight leg raise test are powerful diagnostic tools as well as baselines for patients with compressed nerves or irritated nerves in a lumbosacral spine. They are positive if the raising of the leg reproduces the patient's concomitant symptoms in the lower extremity, typically pain below the knee or numbness or tingling. But I use this test for mechanical problems as well when there's not a specific major nerve root problem in the low back. What I mean by that is I use it just like I use a range of motion test or a true nerve tension test. So if it's not symptomatic, it can still be a sign if you're not getting the leg all the way straight or if it feels really restricted to the person. So when I perform the passive straight leg raise test, the patient is lying on his or her back. I'm holding the leg, making sure that they're relaxed and raising it to perpendicular to the floor. And what I would like to see is we get close to 90 degrees with just a normal kind of stretch. For patients on their own, they can't do it passively like that, of course. So I teach them how to do it at home if they want to monitor for change. The way that is used is the knee is above the hip joint, you're holding the posterior thigh, and you're extending the leg up to the ceiling. And again, if we can get that knee straight, we're getting close to 90 degrees or perpendicular to the floor. So if you want to test this mechanical movement, knee above the hip, stabilize the thigh, and kick it up as far as it will go. So the point I'm trying to make, not only is it, I wanted to show how you can do it independently to monitor for true nerve tension changes, but you can use it to monitor for mechanical changes. So this passive straight leg raise test, I commonly use as a mechanical baseline for patients presenting with low back symptoms or disorders stemming from the low back. So I'm not necessarily testing the integrity of the sciatic nerve, although that might be at play. What I'm finding is that if you get the low back moving well again, if there's a mechanical disorder that can be resolved with 1 or 2 movements of the lumbar spine, then this straight leg raise test passively becomes looser. So I think of it as a mechanical problem of excursion, just like I think of knee range of motion or hip range of motion or spine range of motion. So I often use it for patients with what I think to be lumbar disorders as a baseline. So we're taking lumbar range of motion, but then I'm always looking for things, especially if the patient has symptoms in the thighs or hips or knee area, I'm looking for baselines in the extremities as well, because the more solid baselines we have, the more we can test for cause and effect and really get an idea of the diagnosis with repeated movement testing. So for patients with low back disorders, I'm usually using this passive straight leg raise test, and I'm not necessarily implicating the sciatic nerve, but I'm looking for changes in the excursion of this test. I'd like it to get close to 90 degrees, like I said, obviously asymptomatic. But people think that hamstrings are the only thing that restrict this range of motion, and I want to point out to people that what I find is it's a mechanical problem, a movement problem, not a tissue restriction problem in most people. And if you get the low back moving well, or if it's a hip problem, you get the hip moving well, then this passive straight leg raise improves.